All right, Dr. Emer, we are live.
Hey, you guys, it's Dr. Emer. We were in the OR this morning and now we're in the patient room. And we're doing one of my favorite treatments actually for my younger athletic men. This is using Sculptra with Bellafill to lift the buttock. Now in the old days, people used silicone. Not something you should do because it causes a lot of side effects, and you guys have seen in the news many different reports of that going wrong, even causing death in people.
We've seen that in
What
the OR.
was
I
that?
say we've seen it in the
We've seen
OR.
it in the OR before we've done lipo, actually in the buttock, and silicones come out. Someone who didn't even know they had it. So we're using something that's FDA approved to produce collagen, both a long-term filler called Bellafill, which is used for acne scars, and then Sculptra, which builds collagen. So he already has a nice buttock, and I'm going to focus just a couple syringes of each. We call this the Bella Lift because we use both the Sculptra and the Bellafill.
Yeah, we have the questions coming in.
Little pinch and burn. And this has some numbing in it, so after just a few pokes, he won't really feel that much, which is great. But I'm going to focus this really on the upper part of his buttock. We're using a couple vials of each just to build that, collagen over time. The cool thing about the Bellafill is it has beads in it. Those beads will build collagen and actually give an immediate lift, but then the Sculptra will build collagen over time, up to 3 years. My best friend actually does this every couple times a year and works out, does a lot of exercising on his butt, and it just makes his butt bigger each year. So as you age, the buttock tends to fall, but if you use Sculptra and Bellafill, you're gonna keep
We have our
that
people asking
buttock really good.
Asking how much, guys. Send us a DM, full name, email, and phone number. We'll get out to you. That goes the same for the people asking about Florida. We'd love to get a hold of you too. Someone just asked us about that. We just put out our dates right now on our feed. Someone said, I need facial stuff, guys. We do everything, face and body here.
As hard as you can.
Get in contact with us. We'd love to have you.
Perfect. So you guys see it's elevating. Now some of you guys will see the top part is elevating here. Another pinch. This is going to be a little larger today, and then it's going to kind of disappear a little bit. He'll still see a little bit increase in size, but it's not going to be as impressive as today because there's a lot of fluid that's in here. This fluid will go down, and then as he exercises and build over the next 6 weeks to 12 weeks, it's really going to build up. And then again, this is going to last a couple years. So you guys can see in there, look. The Bellafill is inside the Sculptra particles. And we call this the Bella Lift. It works amazing. I have tons of clients that do this. I actually have been wanting to do this myself because you guys know I've been on a workout kick lately. So this will just enhance everything.
For those of you guys, if you're lucky, we have an amazing follow-up coming in today who actually did this a while ago. So we'll show you some long-term results of our male soccer butt BBL combined with the Bella Lift.
Perfect.
We'll be showing you guys that today.
A couple folks left. You shouldn't feel too much right now. And that's it. And so you guys see we're just filling up that portion. And with guys, you don't want to go too lateral, you guys. You want to keep it, again, where there's a little indentation over here, and we focus a little bit more in the middle to lift. And then obviously building some definition in that middle area. So when you'll see when he squeezes now, go ahead and squeeze. You can see that elevation now, right here. And that's called an S curve. We call it soccer butt, whatever you want to call it. It's got a lift. So now we're going to go to the other side. That side's done. Squeeze again. Perfect. Relax. He's very muscular. We just want to get it to be a little more volumized and have a little more curve without having to have surgery. This is really good for my males and females that don't have a lot of fat. Because if you do have fat, you could use fat. If you don't have fat, what can you do? You could use Sculptra like we're doing here. We could do the Bellafill like we're doing here. You can use hyperdilate radius.
Our slim patients love it.
Now I love hyperdilate radius. The problem is it takes a lot more to actually see the result, which is more expensive. Squeeze in as hard as you can.
For those of you curious of the hyperdilate radius, you guys will see, go to our reels. We have a very cool one over there. We did some hyperdilate radius to hip dips. For one of our slim female patients, she had amazing results.
Very good results.
Very good. She
did a lot.
She did a lot of hyperdilate radius, guys.
She did a lot of hyperdilate radius. So if we're trying to be focused and do just a few syringes here or there, this is a better choice. Plus, he's going to get the permanent long-term improvement from the Bellafill. Pinch. Now, some people will even use Renuva. I have another client that really likes Renuva mixed with Sculptra. He's tried the Bellafill. He's tried the Radius. He didn't like it, but he liked the Renuva. I find that it doesn't last as long because it's a synthetic fat, and set in younger and very slim people, fat doesn't survive as much. So I personally like the Bellafill. Squeeze again, relax, look at that, perfect, it's looking really good. There's different ways you can use a cannula. I find that using the needle in multiple layers here makes it more even, especially when you're using permanent filler. Almost done, you doing okay?
Mm-hmm.
Good, just making sure.
Mm-hmm. Thanks.
Want everyone comfortable here. But again, I'll show you again, we're almost done, just a few more syringes, squeeze in again. So you guys can see, look at the elevation there. It's great. Little pinch. What are they saying, Jordan?
A lot of people watching us. A lot of people are amazed what we're doing. They're hitting our they hit on our patient a couple times without even seeing his face.
They like his butt. So that's good. That's what we
They like
want.
where this is
That's
going.
the goal. That's what we want.
We have all the funny stuff in the comments today.
Really? Yeah, my patients tend to. This is the next form of social media dating. Right?
What I need.
Exactly.
Mm.
We'll call it Hinge Cosmetic. That's hilarious. No, every time we do something, people are asking for names, numbers, and phones. I'm gonna do one extra on the other side.
Okay.
Take that one. Do a little more over here. You can see now, look, this is where it is. See I'm squeezing? That's where the filler is. Take a look. It's all evened out. I'm gonna add a little bit more here. This side, I think needs a little bit more compared to the other.
How many treatments of this do you recommend for someone?
Look, the more you do, the bigger it'll get. So it just depends on what you want. If you want more, you do more.
How long before he can sit on it?
Today, right when he leaves. No restriction. Or wait, what are we talking about? Depends on what they're asking. But for just going to sit on a chair, you can do that immediately. I want you to massage this area. So I like actually when people work out, even the next day or the next day. There's no restriction on this filler.
Do you ever do it at the bottom part where the cheek meets the thigh?
Yes, I do. But in this case, we're trying to get lifting, and we don't really need it there. I want that curve for him. So I'm transitioning the upper pole to the middle for him. But yes, it would just require a lot more volume. So let's focus. If we have a focused amount that we're going to use it on that focused area. And that's it. So you guys can take a look. Now what's great is look at the cleavage on his buttock. Go ahead and squeeze again.
Someone said I need this bad, guys.
See the cleavage on his buttock. See the S curve, what we call the hourglass look. And this is really more of a soccer butt. It's way more horizontal rather than lifted like a female. And you have the indentation on the side, which defines the connection between the hamstring and the hip bone or the IT band, so it makes the guys look like they have a perky butt. So that is our perky butt Bella lift. Get ready for the summer.
All right, guys. A couple last questions, guys. So I need this bad. Send us a DM, full name, email, phone number. Is that hyaluronic acid? No, this is not hyaluronic acid. This is Bellafill. This is our Bella lift, Dr. Emer's signature procedure.
And that's it.
There
We're gonna put him under red light so he doesn't get too bruised or swollen, and then he can go on and just enjoy his weekend. Bye, guys. Was it too bad or okay?
No, actually, I'll show you.
You did great.